We're now going to, that's the rest of our deputations list. At this point, we're moving it into committee, and this is the chance for members of the board to ask questions of staff. Do I have anybody with questions? Director Sue-Wong.
Thank you very much, Mr. Chair. So I have a question through you to the Medical Office of Health. There was a recommendation dealing with the College of Physician and Surgeon. So can you elaborate a little bit further? Because I'm not clear in that particular, I don't have it in front, let me just read the yellow sheet. There was a section there that talked about the sharing of the email address. This is the first time I've heard about this. So am I clear when I read your recommendation, Dr. Davila, that the college is refusing to share, I considered that as a public information, so they're refusing to share the email addresses of physicians working here in the City of Toronto in this conversation about the vaccination piece?
So through the chair, the short answer is, what we're trying to do is get the email addresses of Toronto physicians so as to facilitate communications with them. I will ask Dr. Dubé about previous attempts that we have made as a department to access this information.
Getting email addresses for physicians will enable us to give timely information to physicians. We do currently get lists of physicians' fax and address information, but we don't currently have access to email addresses, and we want to be able to have a way to communicate with physicians in an efficient and timely manner. So
my follow-up question, Mr. Chair, what's the rationale? Because this issue here, is it the college see this as a privacy issue? Because at the end of the day, this is public safety, right? So I'm just not clear, because if this is good for the City of Toronto, let's call about our colleagues across the province, because this is not just the City of Toronto issue. This is the province issue. So my question is, through you, Mr. Chair, to the Medical Office of Health, why is the College of Physician and Surgeon not see this as public safety, public information to share with a public board?
So through the chair, I'm not sure that it's appropriate for either myself or Dr. Dubé to speak to what the College of Physicians and Surgeons of Ontario is thinking or what their rationale might be. Happy to have the conversation with them and let them speak for themselves, but clearly we see an importance to providing or to having the email addresses of Toronto physicians, and one might argue that there would be benefit for other local public health units to get email addresses for their own respective physicians to facilitate the flow of information on matters of public safety.
Thank you.
Thank you. Any other questions? Director Bauer.
Hi. Thank you very much for the report that was put together. The recommendation, one of the recommendations talks about the functionality of Panorama and a couple of ways of increasing the functionality of Panorama. I wondered if you could just give us a little bit of detail on what that would look like, because as a healthcare provider myself, I think the reporting part of this is currently a barrier for a lot of families and healthcare providers.
Thank you for the question. So Panorama is our the provincial system that we use electronically to house immunization data. And it's a step up from where we were previously, but it still has some limitations in its function. So, for example, right now we cannot run coverage reports by, for example, postal code or by, for example, certain socio-demographic or social determinants of health to be able to determine where we may have pockets of under-vaccinated individuals in the city who may require more resources, for example. So that's one of the ways in which we want to increase the functionality. Another way which we have continue to be vocal on is right now it's parents who are required to report vaccinations directly to public health in accordance with the Immunization School Pupils Act, and it's the parents' responsibility. Currently there is legislation that is on hold requiring physicians and other healthcare providers to report directly to public health, and so that's another one of the recommendations, that if we got the immunization information shortly after the immunization was provided in the office directly to public health, well then it would take the burden off parents, and it would also allow us for more real-time data and analysis of immunization rates.
Thank you. Any other questions? Director McKelvey, and then I have Director Layton.
Thank you, Mr. Chair. My question is for the Chief Medical Officer. Can you just outline how your recommendations interface with those coming out of the World Health Organization, and in particular the Salzburg Statement on Vaccine Acceptance?
The World Health Organization has recognized the role of the internet and social media sites on influencing some of the information that's available, some of the false information that's available. We included the recommendation from the Salzburg report group because it was a comprehensive recommendations made up of a number of different health specialists and consistent with the information or recommendations that the World Health Organization is also making, and seem to play to specific interventions that these social media platforms and search engines can actually do to improve the public's health.
So your recommendations are consistent with what's starting to be done internationally?
Well, right now the recommendation is for the search engines and social media platforms to make the changes of their own. And so it's kind of a self-regulation or a recommendation that they make the changes. There currently is no, for example, legislation or anything beyond a recommendation coming out forcing these platforms to make the changes.
And then I just want the words that are used throughout are request and consider, and I see that over and over again. So it looks like ultimate authority here is with the province and the federal government for some of these recommendations that you have?
That's right. So the ones that say consider or recommend, it's where the jurisdiction to make the decision does not lie with Toronto Public Health. It's either the Ministry of Health, federal government, or internationally.
Okay. And then the last is regarding the recommendation 1B, about removing exemptions. You aren't recommending to remove medical exemptions, right?
That's right. First of all, it's consider the removal of philosophical and religious exemptions, but those who have a medical reason for not being vaccinated would continue to maintain their medical exemption.
As they should.
As is, yeah.
Thank you.
Thank you very much. Next I have Director Layton.
Yes, thank you very much. And continuing on that line of questions from Director McKelvey, the report on page 9 demonstrates a doubling in the exemptions rates over the last decade, but then it says we haven't quite hit the rate of dangerous levels of exemptions. Is there any idea of what that rate is?
We know for different diseases, what we call herd immunity rates are required. So for example, for something like measles, typically 95% of the population needs to be considered immune. So either vaccinated or protected because they previously had measles. And so right now our rates in schools are 94% among vaccinated individuals. So for something like measles, having 5% medical exemption rate might be too high and could result in outbreaks. In places like California, there were instances where medical exemption rates were, for example, 10% and definitely resulted in outbreaks. So it depends on the disease, what that particular kind of worrisome spot is. But for something like measles, you do not need a lot of medical exemptions in order to have pockets of unvaccinated individuals leading to outbreaks.
And we measure the exemption rates citywide?
Those are Toronto rates, but the rates have also been shown, this same pattern has also been shown in Ontario in general.
And as a response, it says here that California took action to remove their non-medical exemptions, correct? When was that?
That was recently, in the past year or two, when California removed their non-medical exemption. And there have been studies that have subsequently shown that the removal of the non-medical exemption rates have subsequently resulted in higher immunization rates in the schools.
Now, can I just one last line of questioning around compensation, the injury compensation program. It's existed in Quebec for 40 years?
Quebec has had a vaccine injury compensation program for that long, and that was the material that was included in the report. No other province in Canada has gone ahead or has even, I don't know if they've contemplated or has one anyways.
Is there a rationale for why? why it hasn't been established in other jurisdictions?
I believe Quebec has a history for why they went ahead with it 40 years ago, and I'm not clear on why other provinces have not, do not have one currently.
Through the chair, however, I would add that there has been active conversation, and in fact it's been in the medical literature and amongst public health circles talking about the notion of a compensation program for many, many years now.
Okay.
Yeah.
Thank you very much.
Ladies and gentlemen in the public, this is the absolute final warning. We will have to clear the gallery in order to carry on if there's another outburst. Thank you. Any other questions? Trustee LaPretti.
Through you, Chair, to staff, I was wondering if you could elaborate on the recommendation number 4, provide financial incentives to promote vaccinations for local healthcare providers.
Absolutely. So the Ministry of Health, or the Ontario government, recently released an Ending Hallway Medicine plan. And in there, it included a number of recommendations, such as engaging Health Quality Ontario to provide physicians with some of their metrics for some of the way they're responding to their population and meeting some of the healthcare needs. And in that report, it said that another way in which Ontario can move forward to achieve good health outcomes is to provide financial incentive to physicians. And so that was something that was included in the Ending Hallway Medicine report. And so if the ministry is considering providing financial incentives for physicians, for example, who have high rates of X, Y, or Z, this would be one area in which they could also consider providing financial incentives. So it was in that context that this recommendation was made.
Okay, thank you.
Any other questions? I have 2 questions. To our Medical Officer of Health, in your opinion, as our Medical Officer of Health, are vaccines safe?
So through you, Mr. Chair, I don't think I can say it any better than it's stated in the report. Vaccines are safe, they're effective, and they are truly one of the most important contributors to improving health worldwide. You will see also in the report that there are rare instances where serious reactions can occur, but that doesn't take away from the fact that they are one of the most significant life-saving interventions that has occurred in medical history.
And my second question is, given the rise in vaccine hesitancy that we have documented, that you have documented in the report, does that necessitate a scaled-up approach and strategy from all levels of government to tackle vaccine hesitancy?
In short, yes, and that's why we've put these recommendations in front of the board for your consideration today.
Thank you. Those are all my questions. I'm going to move in towards speakers. Speakers, I have Director Perks.
Thank you very much, Mr. Chair. As some of you may know, for about 20 years before entering elected office, I worked in the environmental movement, particularly in the area of human health and the environment. I taught that subject at the University of Toronto. I studied it as an undergraduate student. And in doing that work, I learned to think about topics like this requires great care. One of the things that I've heard today several times is this notion of body autonomy. And I think it's very important that we interrogate that and understand that. First of all, biologically speaking, there is no such thing. Every human being trades bacteria, viruses, genetic information with other human beings all the time. If you live in a society, that's a fact. Another piece, though, that isn't thought about as carefully is that the results of human action are constantly interfering with our health. From the moment of conception, we're all exposed to persistent organic pollutants that are the result of the chemical industry. Every breath that we take contains emissions from the fossil fuel industry. Every moment of every day, from your first breath to your last, human action is affecting your health. The idea that there's some state you can achieve of bodily autonomy where human actions don't impact your health is a false dream. It's something that if you allow to lead your thinking about how you look at issues like vaccination, you will be led to a wrong conclusion. The problem we have, in my view, is that we don't make enough intentional interventions in human impact on human health. Prior to the rise of public health, 40% of all children born did not make it to adulthood. 40%. Some say 40, some say 50, but I'll take 40. It's the lower number. We are sitting here in a moment of extraordinary luck and privilege that we don't have the epidemic of childhood and mortality that everybody prior to the rise of public health interventions experienced throughout the globe. Every family lost a child. Many families lost all of their children. But interventions like treating drinking water, vaccination, thinking about nutritious food, educating young girls in sexual health, these public health interventions are the reason that we have the civilization where we can sit and argue about vaccination. If anything, we need to be more aggressive about having public discussions of what we can do collectively to protect health, not fewer. If anything, we must do more to dispel the myth that it is possible to live with some kind of bodily autonomy. It's not biologically practical or possible. There is no human being alive whose health hasn't been impacted by human intervention, and there never will be. We have to do it with intention instead of simply wishing we could live in some pristine state, which none of us ever has lived in and none of us ever will live in. I salute the courage of the medical officer of health and the health professionals that we've heard today for standing up for this important principle, despite the concerns that many have raised today. It's hard to do, but it's necessary if we want to have a healthy population. So I will be supporting the recommendations in front of us.
Thank you, Director Perks. Others to speak? Director Sewell.
So this issue is very personal for me. As some of you know, I was a former public health nurse. I was also that immigrant kid who experienced many racism in the city, and I still experienced that before I came here as your colleague on this board. I'm voting for these recommendations, Mr. Chair, because of that little girl whose classmate in Hong Kong was suffering from polio. I remember this little girl couldn't climb in the playground. This issue that we are confronting with today, no different than what this board passed when I was here, when Councillor Layton's father and I debated on tobacco. This issue was also the similar issue when I was here on this board, when we debated on fluoride, right, Councillor Perk, remember that? So if the intent of this board, our legislative responsibility, education, awareness, and prevention, we have to do the right thing. This is no different that we did, and this board led when it comes to tobacco strategy. This board led on that issue, because I was around back in the 80s as a young public health nurse. So when I vote today on these motions and the chair's newest one that's come before us, I'm voting for that little girl who couldn't climb. She was my classmate when I was in Hong Kong. So we need to address those issues. Thank you, Mr. Chair.
Thank you, Director. Any other speakers? Okay. I'll speak then, and first of all, I will be moving the staff recommendations, and I have an amendment as well, if it can be placed on the screen, which is to request Health Canada introduce legislation to restrict inaccurate and misleading anti-vaccine messaging that is targeted to the public. Let me begin, first of all, and I have moved the staff recommendations, by thanking our staff for their tremendous hard work and for their proactive work, as well to the deputants, all the deputants, for being here and for talking and coming to speak to us. But if anybody had any question as to whether tackling vaccine hesitancy was an urgent issue, and one that the WHO has said is one of the top 10 issues facing the globe, I think this morning demonstrated that we have work to do. Let me be very clear. As our medical officer of health has stated, vaccines work. Full stop. There is an abundance of scientifically proven evidence demonstrating just that. In fact, vaccines have saved more children's lives than any other healthcare intervention in human history. And they have indeed eliminated once deadly diseases and drastically reduced the risk of others. So why are we here? We are here because in 2019, in the 21st century, vaccine hesitancy is on the rise, where we have across the United States and in Europe measles outbreaks leading to deaths. And in Canada, where we have 20% in this city of parents who are vaccine hesitant. And we also have a rise in false and misleading advertising. And the risk is clear. The risk is clear for herd immunity, but the risk is also clear today for kids, for pregnant women, and for people who are immunocompromised. And so at the Toronto Board of Health, in this society, as the chair of the board, I'm not prepared to wait for an outbreak. I'm not prepared to wait to act. Rather, based on the research and the evidence and the trends, we are seeking to proactively work to prevent that outbreak. That's what this report is. In April, when we asked our staff to come forward with proposals for a comprehensive approach, we did this because we've already seen in California, in Washington, in New York, states have been forced to respond after the fact. What public health is fundamentally about is prevention. This is an upstream action that's required, and it requires all levels of government, at the city, for us to engage in more public education with healthcare professionals and students and the public, with the province to improve and implement an improved online data system, and to consider removing the non-medical exemptions, and for the federal government to look at the risk around advertising, and for the private sector and the social media companies to treat these the same they do with other misleading advertisements. Now, some have said that vaccinations are an infringement on individual rights. Well, people have the fundamental right to believe what they want, but they do not have the right to endanger others. At Toronto Public Health, we will expedite our work to promote and defend vaccinations, and in 2019, in the 21st century, we will once again work to not only defend science, but to protect the health and well-being of our society. Are people comfortable taking a vote on the package? Or do you want to separate them out? No, we can do the one separate if you would like that. It's a school board related one? Number 4. Okay, so for the clerks, there is a 1A4. 1A4, provide financial incentives to promote vaccinations for local healthcare providers. You want to vote on that one separately? Okay, so we're going to vote on that, and then we're going to take the rest as a package, if that's all right? Okay. So on recommendation 1A4, all right, all those in favor? Opposed, if any? Thank you. On the package as a whole, then, now that we voted on that, I'd ask for a recorded vote on this, please. All those in favor?
Director Ashna Bowery, Director Stephanie Donaldson, Director Angela Johnson, Director Cynthia Lai, Director Mike Layton, Director Kristen Wong-Tam, Director Joe Cressy, Director Lepretti, Director Jennifer McKelvey, Director Kate Mulligan, Director Gord Perks, Director Peter Wong, Director Sue Wong.
That's unanimous. Members of the boards, we will now adjourn until 1:30 for a lunch break. 1:30 for a lunch break. Thank you.